You are tuned into The Agenda with myself, Sonal, covering for Georgia over the next 2 weeks. And we're doing a bit of a deep dive into a news topic. This all has to do with the change in taxes on sugary drinks. Now, we're talking about a decision that's been made from next year that this will not have a flat excise tax, which is already in place of 50%. But we're actually going to be seeing different tiers or different tax levels depending on how much sugar is in each product. This is going to change consumer behavior. This is a question we've been asking. Is it going to change how manufacturers approach making these products as well? That's something we've been talking about. But how much actually of a difference does it make to your health when you cut out these sugary drinks? And that's what we want to talk about now. We're joined on Teams by Dr. Mohammed Saleh Ahmed, who is consultant endocrinologist at Al Zahra Hospital. Dr. Mohammed, thanks for joining us on the show today.
Good morning. Thanks for having me.
Now, Dr. Mohammed, let's talk about the link between high sugar intake and some of the broader health issues that we see a lot here in the UAE, like obesity and diabetes. How much of a contributing factor, is a high sugar diet to having some of these conditions?
Right. So let's start by looking at the size of the problem in the country, and it's almost similar to other GCC countries as well as worldwide. So in the UAE, we have around 20% of people, like 1 in 5 people who have got diabetes as adults. And this is from 2024 data. And also there is a rising rates of obesity, which is going up to 37% of adults who are obese. We are expecting more people to develop diabetes if nothing to be done. And unfortunately, there are around 34% of children who are overweight in the country. And this is, as you say, almost similar to numbers worldwide. Now, when it comes to what we call sugar sweetened beverages, as SSBS, these are a major contributor to excess calorie intake and metabolic dysfunction. And when we say metabolic dysfunction, we are not talking only about diabetes, we're also talking about fatty liver disease, which is a silent killer and a major risk for metabolic disease, cardiovascular disease, as well as many types of cancers. So the SSBS have got high fructose content, and that leads to insulin resistance, weight gain, and obviously the increased risk of type 2 diabetes.
You know, with your patients who decide to cut out sugar, how much of a difference really does it make to their life? If you've been on a high sugar diet for, let's say, most of your life, and you make a dramatic change at some point and dramatically cut your sugar, what kind of difference can that make?
Well, there is a lot of data on this worldwide and in GCC countries. So we have seen that the childhood obesity in particular, which is a major risk factor for obesity in the future, has improved significantly in many countries around the world when they cut sugar in their diet. And I can give you some examples of that. So when the UAE started the 50% excise tax in 2017, this has reduced the sales from 7.4% to around 6%. And also in Saudi Arabia, we have seen a sharp drop in the sales. And what does that result in? That results in reduction of around 9.5% in incidence of diabetes in countries like Saudi Arabia and in Bahrain. So by cutting down sugar, we are seeing less obesity, especially in adolescents. And this is the group of people who are more prone to take the high sugar contents either in fizzy drinks or in other forms of sweetened diets. And hopefully by 2023, especially with the new tier enforcement of the tax in UAE, we are seeing similar rates by 2030.
You know, Dr. Mohammed, drinks can be such a confusing area for so many people, even those that want to be healthy and make a proactive effort to be healthy. Sometimes they think they're being healthy, but you think, well, there's a lot of sugar in a smoothie that's got a lot of nice fruit in it. And, you know, there might be some sugars in your electrolytes. And drinks can be a little bit more difficult to tell. I think there's the obvious case of certain well-known carbonated soft drinks that, you know, okay, well, this just got loads of sugar. This is not good for me. There's nothing good in here. But what other areas do people need to take care of when it comes to drinks where they think this is healthy, but actually maybe it's got a lot of hidden sugar that they're not aware of?
Right. So if I'm trying to put this in a simple way of thinking about diet in general, not only sugar, let's start with the fact that we put on weight because we are taking higher calories. And higher calories can come from different sources. And that includes the fructose, which is available in high amounts in fizzy drinks, less in fruit drinks like smoothies, for example. That's with no added sugar, okay? And in electrolyte drinks, but the fact that fruits has got fibers make the absorption of fructose less compared to beverages and to alcohol, for example, because it has got very high amount of fructose as well. But overall, any diet which has got high amount of calories can lead to obesity. And obesity is a major risk factor for diabetes and for the metabolic associated liver disease, which we have mentioned at the beginning of the interview. So we have to be careful about how much calories we take. Now, in the new world of apps, there are so many apps which can tell you how much calories on each type of food you are taking or each type of drink you are taking. And believe it or not, most adults don't need more than 1,400 kilocalories to keep them going per day, while most of us are taking between 2,000 to 4,000 kilocalories per day in average, and some of us are taking even higher than 5,000 kilocalories per day.
For some people who want to make changes, and for patients perhaps that you advise, what are the most effective interventions that you can suggest to people that, you know, for families, for example, where it really works? Because, of course, sugar addiction, it's such a sensitive one. It's so easy to be like, well, just don't eat the cookie or don't drink the drink. But those cravings can be so powerful once your whole body is attuned to and accustomed to a certain level of sugar. Is a gradual reduction a good idea, or should you go cold turkey? I mean, what's your general best advice for people?
Well, I think, first of all, you need to remember the psychology of children is different from the psychology of adults. Children are brought up to follow rules. Okay, so if you tell them what to do and you are very clear about that and you work around that, they will listen. While adults, if they're going through stressful time, anxiety, pressure at work, pressure at life, they need to seek help around these psychological factors because these are likely the underlying trigger for what we call non-hunger scale eating, other people call it comfort eating. Okay, so these are the things we need to work on. But for children in general, we need to make sure that we are replacing sugary snacks with low sugar alternatives, like unsweetened popcorn, vegetable crisps or fruits. We have to be careful with amount on the other hand. Obviously avoid sugary drinks, that's very clear. At home, we need to use nutritional labels to identify hidden sugars. And you already mentioned this in your question. And we need to make sure that we are towards cooked meals rather than delivered food, because with the cooked meals we can use ingredients that's having lower calories, and that might help as well. And there are behavioral tips like emotional eating, addressing triggers like, as I said, stress, mood, and model healthy habits.
Dr. Mohammed, thank you so much for your advice for all of our listeners out there today.
Thank you very much for having me today.
That is Dr. Mohammed Saleh Ahmed, who is consultant endocrinologist at Al Zahra Hospital. And that's our sort of take on some of the different issues related to this change in tax on sugary drinks, from how much of a difference these kinds of taxes make to the impact these drinks make on your health. If you want to catch all of it, it's going to be available on the Agenda podcast. For now, let's have a look at how it's going out there on the roads.
Dubai Eye 103.8 traffic.
With Yas Island